Hey YouTube, it's Salams. So I haven't posted in a while, and I wanted to post a 6-month post-op video after my top surgery to show an update and talk about what's going on, etc. So I guess I'll start with a little update and then show the chest and then talk about revisions, which is going to be the next step. So I'm actually now 7 months post-op, but nonetheless, nothing has really changed that much since 6 months. So it's kind of the same situation. Overall, I'm really happy with my outcome. I'm so thrilled with my body. Like, I feel so much better about myself. I can't even put into words how good I feel on a daily basis. It's remarkable, I'm so grateful. I went to Dr. Mosser in San Francisco, and my surgery was January 4th to 2018, so about 7 months ago now. And yeah, the first few months were rough, but it's been a lot better. I haven't had any issues, kind of on the day-to-day. I mean, I would say that I am now able to put my hands over my head and stuff like that, but I definitely feel at certain positions, I feel like the scars pull a little bit, and that makes me nervous. So I don't really know if I should just be avoiding those positions. I probably should have talked to the surgeon about this, but I did not. Anyway, I don't know if I should be avoiding that. I can't even come. It's usually when I'm sleeping, I'll turn on one side and it'll feel like it's pulling, and that does not feel good. So I just generally avoid that. If I stretch too far up, kind of if I stretch and try to touch the ceiling, that hurts, and I avoid that. But I don't generally try to touch the ceiling. Luckily, that's not an issue. So I guess I'm thinking of if I'm trying to get something out of a really high cabinet, that can be painful. So, I use a step stool, and I just am careful, and I imagine eventually it's going to get better. There's still some numbness, actually, in the chest. There's still some numbness. There's still some nerve weirdness. I feel certain areas, kind of not shooting pain or whatever, but certain areas, I just kind of feel sensations in a lot of different places. You know what I mean? Nerves, weird nerve stuff. And it's a little odd, I'll be honest. I don't like that feeling. I know the nerves take a long time to heal, so I'm just trying to be patient with that. And there are some areas that still feel tender, so that's kind of the lay of the land, if you will. But I'll show you my chest, and I'll talk about some of the stuff that I want to get revised. And the lighting's terrible. Jesus. Anyway, I hope this is helpful to some people. So, chest situation is happening. The cats might get involved. They like this. Right, Mona? Okay. So, this is the situation. I am not really on testosterone. I've taken it a handful of times. So, that's, my situation. I have 0 muscle in my chest. So, if you're like me, this is maybe results that you could potentially get. So that's kind of what we're dealing with here. So, overall, I'm really happy with it. You have kind of it's a sort of actually it's sort of an odd angle. Let me go over here. Okay. So this is the chest situation. Basically, yeah, the incision is still quite thin. My doctor was really insistent. Dr. Mosser was really insistent about not massaging it. He told me if I massaged it, it was going to stretch. And so I didn't massage it at all. I did for a while use the scar strips, and I tried, I tried the scar strips, and I didn't like them because they just peeled off constantly, and I just was really irritated by them. So I got this scar gel. It's the same brand, and I used that for a while, and that was actually much more easy to use. So I would just use it in the morning and then leave it on, and then I would wash it off. It's very sticky, but I didn't have any problems with my clothes or anything like that. So I used the gel. I mean, I don't know. I don't have any problem with how the scar looks. I think it looks fine. I imagine it's going to fade more over time. I'm really pleased that I don't have breasts anymore. So like kind of in comparison to what was going on before, like everything I have right now is like really good. Anyway, so there's that. I like the placement of everything. Yeah, so there's like a dog ear here, as you can see, like a small dog ear here, and then there's a really tiny one on this side, which you probably can't even see, but it is there. So yeah, if I kind of go like that, you can see it. All right, so there's that one, and there's that one. The background is not helping. Yeah, so they're small, and so I do want to get those revised. And he says he could do that in his office. So I am looking forward to. Well, I'm not looking forward to a revision. Let's just be honest, but I'm looking forward to like potentially that not being a big deal. But I'm going to talk about some other things. So as you'll see, there is some kind of rippling. So I had a lot of extra skin. And you can see that there's like kind of a little bit of like rippling here. It's not quite very tight. It's not very tight. And yeah, so that's something that, you know, and then, you know, I mean, this side actually is okay, but this one, it's a little bit ripply. And I imagine if I was like on testosterone and had bigger muscles, it probably wouldn't be an issue. So I'm a little torn about it, frankly, you know, like he said he could revise it, but what that would involve would be to like basically recut this, regraft the nipple. I mean, basically he would like pull the skin down and then just like redo it, basically. Regraft the nipple, pull the skin, make it really tight, and he would have to do both sides. So it's essentially, it would be like almost like getting surgery all over again, and it would have to be in the OR. So I'm not feeling good about that, although, I mean, I would like the aesthetic change, you know, because I don't love the extra skin. But I don't know. I've got to think about it. He said he would do it with no surgeon's fee, so I don't know. It's something for me to think about. The other issue is the nipples. So it looks like my nipples have developed some kind of scar tissue under them. So both of them are sort of sticking out, you know, more than I would like. You know, they look like big lady nipples, and I'm not digging that. So what I've been trying to do is like massage, because I know scar tissue generally, if you massage it, it tends to flatten out and stretch. So I've been working on that, and I'm trying to see if that helps. However, what he said he could do is do a nipple reduction, which basically means he would cut into it and then flatten the nipple out. So that potentially could be done in the in like outpatient in the office, you know. So it looks like if I do the nipple reduction and if I do the dog ears, I could probably just have that done in the office. But if I want to go and have this part done, then it would be like, you know, the OR and such. So the surgeon's fee wouldn't apply, but I would need to pay for the operating room. Yeah, I feel overall, I really feel really good about it. This, as you can see, I have sort of an indentation here. And so he had me massaging this area. I'm not quite sure why this happened. So if you could see this nipple is sort of, I mean, actually, I have scoliosis. So if you have scoliosis, you may be able to relate to this. That my right shoulder, if I'm just standing normally, you can see my right shoulder is lower than my left. That is actually just how I naturally stand. And so, as you can see, it impacts this area. If I consciously stand upright, it's fine, you know? So it's just something that I need to, I don't know. I don't know if this is something that is fixable. I mean, just aesthetically, this area, I don't think it is. So I think it's really just my posture. So I just need to work on standing more upright. So anyway, that's the situation. 6 months post-op, 7 months post-op, technically. Yeah, I mean, I'll be honest, I'm not looking forward to revisions. I do not want to go through with it. I do not like the idea of like getting cut open again. I don't want to deal with pain medication and like asking for help from people and like taking off time at work. So I am right now I'm leaning towards, my head is cut off. Right now I'm leaning towards just doing the dog ears and the nipple reduction. But I am going to give it some thought and see sort of how I feel and then make a decision. So anyway, I hope that this was helpful. And if you have any questions, please feel free to reach out. I am happy to answer them. Leave a comment if these videos are helpful. Please like them, subscribe to the channel. I have a lot of content that I have not uploaded yet that I really need to upload. I mean, I actually have a lot of videos that I made prior to top surgery that there's a lot of talking about gender that I think is going to be really interesting. So I will probably get on that soon. Anyway, I hope this was helpful. Talk to you soon.